Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, September 20th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good afternoon. As we face this resurgence of COVID-19 in our city and indeed across Canada, I want to be clear with Toronto residents that we are doing everything we can as a city government to save lives, to protect public health, and to keep our economy open. We're striving hard to achieve all of these goals concurrently if we possibly can. That is the challenge of the resurgence, continuing to stop the spread of the virus without implementing another lockdown that will further cripple businesses, cost jobs, and hurt families and hurt health of people in another way in many cases. We are working with Dr. Davila and Toronto Public Health, along with the provincial and federal governments, to address this resurgence tactically. From the beginning of this pandemic, we have and we will continue to take the advice of our public health professionals. Responding to concerns we've heard from the community, and based on where we have seen the virus transmitting, I am fully supportive of Dr. Davila and her team investigating with our colleagues at the province these 4 areas for action. First, late-night bar and restaurant hours. While we know this could present challenges to an industry that has already faced very difficult circumstances during this pandemic, we have seen other jurisdictions move to earlier closings so as to help decrease transmission, and I know this is something that is under active discussion, as it should be, among public health professionals in the regions and with their provincial counterparts. I support taking action on this, and I'm also willing to explore possibilities for additional relief for those businesses affected by this public health action. Second, masking in workplaces. We know co-workers in some situations have spread the virus to each other. We are looking at how we can make sure people are wearing their masks for more of the time in these settings, especially these workplace settings. We will have an update as we determine the best way in which we can accomplish this. Third, parties. We were pleased to see, and we are fully supportive of the province's action to limit the number of people who can gather in informal settings like house parties and backyard barbecues. But I believe, based on Dr. Davila's advice, that further action is needed when it comes to weddings and other events at banquet halls and other businesses. Once again, I understand the social and business considerations involved here, but there are also some inconsistencies in strictly regulating many types of smaller gatherings and not others. I believe some action should be taken with respect to these types of venues and larger events. Fourth, COVID-19 testing. While testing is a provincial matter, we know we need people to get tested and to get their results quickly, particularly those who are symptomatic. That is crucial to our fight against COVID-19. We are working with our colleagues at the province to ensure that we have targeted testing where we need it and involving, first and foremost, those who need it the most. We are willing to be of assistance, any assistance we can, in quickly achieving this kind of more strategic, targeted approach. And that could include, for example, making city properties available in key areas where we know COVID-19 is on the rise, if that would help. We are willing to do anything else we can to help the province achieve this kind of strategic tactical testing result. Our city's long-term care homes have also been preparing for a resurgence. I requested an update on our long-term care homes from our General Manager, Paul Raftis. Caring for the frail elderly Torontonians in our care is at the highest level of our pandemic priority list. The city's long-term care homes continue to work very closely with Toronto Public Health, as they have throughout, and with Ontario Health, to do everything possible to prepare for a resurgence of COVID-19, including full adherence to all guidelines and recommendations. There were many lessons learned from the first phase, and our residences have implemented those lessons, and we will continue to respond and change their practices in real time as new information becomes available. Our outbreak management team is focused on prevention and mitigation. On the prevention side, we continue to enforce enhanced active screening early, including taking temperature 2 times daily for anyone entering the homes. We continue with masking protocols, which are enforced at all times. Enhanced infection prevention and control practices and procedures, including staff education, high-touch cleaning, and disinfection, all continue. On the mitigation side, we have active surveillance and precautions which will include isolation of residents if appropriate and necessary. Physical distancing will be practiced at all times. The use of PPE, mask, isolation, gown, gloves, and eye protection, and we are fully supporting testing initiatives. We are working with Toronto Public Health and with hospital partners to perform independent infection prevention audits in all of our City of Toronto long-term care residences. We are also focused on staffing in our long-term care residences, reassigning divisional and management staff where necessary, maximizing frontline staff availability, using overtime when necessary, continuing to hire frontline staff as necessary, and redeploying staff from other divisions as necessary. Having a plan in place to take account of the possible absence of regular staff in the event of a resurgence of the virus inside city-operated long-term care residences is also a priority. Today, the city announced a number of city-permitted events will not be going forward up to and including New Year's Eve in Nathan Phillips Square. This is based again on public health advice, and I want to thank organizers for their understanding, and I want to thank the people for their understanding. It has been no joy for me over the past many months now to cancel event after event, as we've had to do so going forward for public health reasons. In most cases, the decisions not to proceed with business as usual were made by the organizers of these events themselves, because they realized they couldn't pull off, or otherwise that it wasn't going to be as good an event given all the restrictions that exist for public health reasons. I want to applaud organizations like the original Santa Claus Parade, who are working on a way to offer up the annual event differently this year, rather than just cancel it altogether. We will have more to say on that soon, but I do think it is important that kids know that Christmas is not canceled, Christmas will not be canceled, and we are working on a way to make sure that Santa Claus can still come to town. We will also have more to say in the coming days about Halloween, and the Chief Medical Officer will address the matter of Thanksgiving this afternoon. I know that the past 6 months have been really tough for people, really tough, and the news that we're conveying today of things to come or things that are not going to come don't make it any easier. I think most of us just wish this entire pandemic would just be over. We want our lives back. But let's remember something else. We are doing this. We are doing the things we're asked to do. We are sacrificing the things we're sacrificing. We are giving up on the events that we're not able to have this year for our grandparents, for our parents, for the frail, elderly, and for the kids, to keep all of them, and they're all in different groups and subject to different vulnerabilities, to keep them all healthy and safe. And yes, we are changing our behavior for the business people too, because they make our lives better each and every day, and they need this virus to be over so they can get back to doing business in the manner to which they're accustomed. So as we move into the fall and the winter, we're being challenged again, as we were in the spring. It seems like so long ago it's almost hard to remember, but we can remember how challenged we were in the spring, and it's happening to us again. I know that we'll meet that challenge, just as we did before, and armed now with the lessons that we learned over the past 6 months of the fight. We will get through this if we do what we have to do for each other. We're doing it for each other. Yes, we're doing it for ourselves, but we're doing it for each other, and if we stay in this together. I continue to urge people to follow the simple public health advice, and I'm sure it's more credible coming from the doctor than it is from somebody in public office, but nonetheless, the advice is the same and it bears repeating over and over again. Limit your contact with people outside of your home as much as you can. Wear a mask as often as you can, in as many places as you can, for as long as you can. Avoid parties and crowds, and wash your hands. You know, it is really not that complicated, even though the issue is massively complicated. And so I thank you for your understanding of all of this news that I have conveyed today, because none of it could be seen as good news in the sense that it's events that are being held or things that we're not asking people to do, but it is for the most important cause of all, which is to protect public health and to protect the lives of your fellow citizens. And on that note, I will ask Dr. Davila to give her remarks for today.
Thank you, Mayor Tory, and good afternoon, everyone. Today, I'm reporting 129 new COVID-19 infections. This new count brings our total COVID-19 cases to 17,971. A total of 15,526 people have recovered from the virus. We were expecting some degree of increase in COVID-19 cases as we reopened our city and more people were interacting. We knew this because of what we saw in other places that were ahead of us in their outbreaks. The resurgence of COVID-19 is concerning to everyone. You will be concerned as you figure out how to be safe and live your daily lives with this virus. The city is concerned as it works to sustain life in our city within the realities imposed by the presence of COVID-19. My team and I are concerned with what we can do to limit the impact of COVID-19 and what I can do to persuade you to take the steps for self-protection. Watching your distance, wearing a mask, washing your hands, limiting your in-person contact as much as possible, and to take these steps consistently when human nature makes it easy to find an excuse not to. We all have to do these things. They will work. But everyone needs to choose to do them so that they can work. It's this simple. The virus needs to move from one person to another to keep replicating. If we keep distance, wear our masks, and wash our hands, the virus has fewer and fewer places to go, and it begins to die out. It won't be right away, but with sustained commitment, the infection rate will drop. Another thing I want to tell you about today is that we've made an important change to our website. We've updated our COVID-19 dashboard to include new information. I think you're going to find these changes to be really valuable. For example, now numbers are presented to show changes since the last update. The numbers are organized to tally up overall new case counts, new hospitalizations, new outcomes as cases resolve, and new outbreaks. The cumulative figures since the pandemic began remain available as part of the dashboard, and there is also detailed outbreak information. I'm pleased that my team has updated our dashboard based on feedback from the public and from local experts. I feel confident the information and content format represents an improvement of high value, and I encourage you to visit it to stay informed. The infections logged on the dashboard are coming from the activities that people choose to do. Unfortunately, many of those choices are driving the case count upward. Our experiences this fall will be the result of how we live in a world with COVID-19. So what does limiting your in-person contact with others look like? It means limiting contact to those you live with. It means reserving contact with others as much as you can to essential areas as work and school. It is not too late to reverse the trend of rising infections. However, we have a particular challenge ahead with many important holidays that typically include large gatherings of family and friends. Thanksgiving is just around the corner, and we know that this holiday is a time of gathering and of celebration. So I'm asking everyone to think about this event now and to plan ahead. As I told you in my last update, life has changed, and all of us have to act like it so we don't make the spread of COVID-19 worse. We need to change for the time being to help us get through these tough times together. Whenever family is involved, change usually involves complex, and often sensitive conversations. I understand that. This is why everyone needs to start thinking about how to celebrate important days in a way that keeps us all safer. COVID-19 spreads when given the chance. Close contact with extended family and friends on important holidays could drive our numbers up. I know it's a big ask. It's hard to do things differently and can be complicated to figure out how. But this year, following tradition is not the best thing to do. I encourage you to talk to your family and make a clear plan in advance on how to mark the occasion of Thanksgiving in a way that limits in-person contact with others from outside your home. In this and in all things, do not let your guard down. Taking steps for self-protection will produce the results we want as we fight the virus on two fronts. The choices we make as individuals have a huge impact. The case count tells us that. The policy choices made by governments at all levels are designed to create conditions to make it harder for the virus to spread. In that respect, I commend the province on their recent announcement to limit the size of private social gatherings across Ontario. This action will help to prevent virus spread. We will keep working with the province to identify ways to strengthen these conditions to fight COVID-19. I also support the province's efforts to provide testing while recognizing that there is a need for a focused testing strategy to maximize outcomes. Please support these efforts by being serious about keeping your distance from people you don't live with. Please keep watching your distance, wearing your mask, and washing your hands often. These are powerful tools. When used together in sequence, these three actions make it hard for this virus to spread. There is an end in sight. We will get through this, but we all need to keep doing our part and to keep taking care of each other. I'll now hand it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. Today is the 197th day of continuous Emergency Operations Center operations. Our EOC continues to operate, and our critical and essential services are being provided without interruption. At present, our PPE levels remain stable, and our team continues to work hard to source the equipment that we need on a go-forward basis. From the outset of the COVID-19 pandemic, our City of Toronto teams have been working in collaboration and cooperation with our colleagues at Toronto Police and Toronto Public Health in responding to complaints and enforcing the laws enacted in response to COVID-19 in Toronto. Last night, we received complaints relating to a large house party in the east end of our city. Toronto police officers responded to this complaint and, following their investigation, laid 14 charges as a result of the large gathering of people both inside and outside the home. As we outlined on Monday, the City is in the process of streamlining and enhancing our response to complaints regarding gatherings in response to proposed amendments to the Reopening Ontario Act and the amended regulations under that Act, which have recently reduced the number of people who can attend social gatherings and organized events. Effective September 19th, the maximum number of people permitted to attend organized public events and social gatherings is 10 people indoors and 25 people outdoors. This includes functions, parties, dinners, gatherings, barbecues, and wedding receptions held in private residences, backyards, parks, and other recreational areas. These limits do not apply to an event that is being held at a place operated by a business or an organization. The enforcement of these emergency orders continues to be a top priority for the City of Toronto, and we have been working closely with Chief Raymer and the Toronto Police team to enhance our collective response to this important issue. Maintaining compliance with these important public health measures is critical to controlling the spread of COVID-19 in our city. That is why we are enhancing our internal processes in direct response to these emergency orders. These changes will include enhanced communication and exchange of complaint-based information between police and municipal licensing and standards. Further, as Chief Raymer explained on Monday, this will also include response by a dedicated team of Toronto police officers in direct response to complaints regarding gatherings. As always, the police will work in collaboration with both municipal licensing and standards, as well as public health enforcement officers. The fines and penalties associated with violations of the gathering restrictions are very significant, but they are also completely avoidable. Ensuring that you do not plan, host, nor take part in any gathering that exceeds the limits established by the Province of Ontario is the easiest and best way to ensure that you remain compliant. The limits that have been placed on gatherings are uncomfortable and inconvenient for us all, but it is imperative that we do our part to prevent the spread of COVID-19 by complying. The sooner we end the spread of COVID-19, the sooner these emergency orders and regulations can be lifted, such that we can all return to normal life. In closing, I want to thank everyone who continues to do their part to help stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Before we go to questions, so reporters on the line know we have staff from Shelter Support and Housing, Senior Services and Long-Term Care, Municipal Licensing and Standards, Parks, Transportation, as well. Police Chief Jim Raymer is also on the line. The first question is to Ashley Legasic from News Talk 1010. Ashley, go ahead, please.
Hi, thank you, Mayor Tory, Dr. Davila, and Chief Pegg for taking my question. I know we don't want to focus on this right now unless we have to, but Peel's Chief Medical Officer of Health this morning said if we did have to roll back some of our reopening, it wouldn't be as simple as just moving back to stage 2. Things have changed. We would have to revamp what would stay open and what would close if we were to roll back. So my question is, does the City of Toronto have a set plan in place on exactly how we would roll back the reopening if it came down to it? And if so, could you please detail the plan and what the breaking point would be for it to go into place?
So Ashley, thank you. I'll be happy to take that, or at least take a first kick at the question. I think that when we look at what actions are necessary, and I think when you look back at how we have responded to all events in this outbreak, it's always been premised on the data and the evidence that are available. So while I can't be very specific around what actions would be taken in the future, as I try not to predict anything about the future, I find that not particularly useful. I can say that as we move forward, any actions that we would take would be premised on the data as we see it here, what the local circumstances are, and the best available evidence in order to control what the particular situation is. If there are particular areas or particular behaviors, let's say, that are giving rise to particular problems here in the city as far as COVID-19 is concerned, then we would try to focus our efforts on those particular areas so as to try to do that balance, to achieve that balance that you've heard us speak about between managing and controlling COVID-19, while at the same time preserving the broader health outcomes and broader health perspectives, including the economic health of the city, the social health of the city, and overall quality of life in the city. So, very briefly, it's all about using the data that we have using the evidence we have in order to control COVID-19 and balance what those control measures look like with all the other aspects of life that we need to consider as our role as public health, and I would say as a city writ large. I'll see if the mayor has anything further he would like to add.
I would only say this. I think all of us from the beginning have looked to do everything that we possibly can, short of having a broad kind of lockdown, because we know that that does its own kind of damage in many different ways to the very people that we're trying to protect. And I can think of no better partners than people like Dr. Davila, Premier Ford, because I can just tell you that in the midst of all the discussion about the science and the numbers and so forth, there's also been always a willingness to discuss a balance between that and the damage that anything that you do based on evidence does in other areas. And we've had circumstances that have changed. The weather's changed. I mean, gone from one set of weather to another and now back to sort of more where we were in the spring. And so I think all those things make it impossible to say that we would be going back to any particular previous phase, but rather you go forward one day at a time. You do the things that are in the interest of public health first and foremost, but also try to achieve that balance. And that's exactly what we're doing every single day when we sit and discuss all the measures we've discussed today and every other day.
Thank you. And for a follow-up, my next question is actually regarding a little bit of what we talked about right off the top, and also social circles. So the 4 measures that are being investigated by public health, just to clarify, I believe these aren't set in stone, but these are just things that are being investigated right now that could help. But we also have been hearing more and more, including from health officials sitting at this table and yourself, Mayor Tory, the more time you can spend not around other people, the more you can avoid seeing and being in close contact with people outside of your household, the better. So at this point, are we talking about limiting the social circles, getting rid of the social circles, as has been suggested in other health authorities?
There's a lot of discussion about this that goes on, and I think some of it is really a response to the fact that people have been creative, as people often are, about social circles and how many you're supposed to have and how they intersect with each other, when in fact the original intention was that you should have one. But, you know, if you look at what we're talking about more often now than even circles or particular kinds of places, we're talking more about how people behave. And so, you know, we're talking about the fact that it's not a bad thing in the context of, say, the restaurant industry to go out and have dinner with your spouse if that's who you live with all the time. But then as you sort of expand that, you know, into other groups of people, other people from other places, and so on, or you fail to wear a mask, or you know, wander around table to table chatting with people, then it becomes what could be an acceptable behavior becomes an unacceptable behavior. So what we're trying to do is achieve a regime here that respects all of the advice we get from Dr. Davila and her team and the province and everywhere else, but at the same time allow a degree of latitude that is quite different than what we had when we were in the absolute lockdown period. But a lot of that depends on people listening to what the doctor has said and following that advice. And if they do that, then we can actually have a life that is better than the one we experienced back in the late winter, but not normal. I mean, just because we're not in normal times.
Okay, thank you. We go next to Carly Thomas from CBC News. Carly, go ahead, please.
Hi there, this is a question for Dr. Davila. I warn you it's a bit personal and sensitive in nature. You may have seen the recent news that Dr. Bonnie Henry in BC has received threatening attacks from the public. What is your reaction to that, and have you personally experienced anything of that nature during the course of the pandemic?
Well, I did hear about that, and you know, it's terribly upsetting. And, you know, my heart goes out to Dr. Henry. She's a colleague, and I would call her a friend. And, you know, I don't think anybody in public service who is simply doing their job and offering the best advice, and I know working as hard as she is, deserves that kind of treatment. I don't think any of us deserve that sort of treatment, but especially somebody who is putting so much heart and soul into public service. And it is an important job. It's a challenging job. And I think, you know, I would tip my hat to Dr. Henry for the excellent job that she's done and her commitment to the people of British Columbia. I think that's something we should, in fact, honor. I fortunately have not been subject to such treatment. I will say that there are occasional moments, as there are, I think, for those of us who live in public life, where you receive, you know, disparaging letters and comments, but certainly nothing that I would characterize as significantly abusive or certainly anything where I felt personally threatened. And I would hope that that wouldn't happen. And, you know, thus far, I have found that I've had the great support of the people, the residents of Toronto, and I count on them for that support, and I would like to continue to provide good support to the residents of Toronto, as this is a job about which I'm very passionate. This is a subject on which I have a great deal of interest and really feel a very strong sense of responsibility to the residents of the City of Toronto.
Thank you very much. No follow-up.
Okay, Carly, thank you. We go next to Matt Bingley from Global News. Matt, please go ahead.
Hi, good afternoon. Mayor Tory, I'm just wondering, the speech from the throne has just wrapped up. I'm wondering if you were paying close attention to it and if you heard what you were hoping to in regards to what you expect for support for the city.
I heard some things that were very good in the short term. By that I mean things that are urgent in nature, such as the commitment by the government to support smaller businesses, especially in sectors like hospitality and tourism. I heard some commitments to continue the work that we've begun, including the announcement this week to end homelessness, because that is a big challenge for us here in the City of Toronto and other major cities across Canada. I heard commitments that were more top level and I guess longer term, in the sense that there weren't very many details about care for our youngest and for our most elderly citizens, and a more activist role by the Government of Canada in those areas, which I welcomed. And then I heard a couple of other things that were perhaps even more localized to Toronto. I heard a commitment that talked about the assistance of the government in forming new urban parks, which could be applied to some of the work we're doing with ravines or with the rail deck park. And I heard about a concern about universal access to broadband. There was a mention of rural broadband, but also the mention of universal access to broadband. And that is something that has really hit home to me even more so than before during the pandemic, because as we now have a situation where people relied for just basic communication with their loved ones on the internet, or they relied, in many cases, thousands of kids today are relying on the internet for their education. And there are people, I'm sure, right now as we speak, who are being left out of the virtual education because they don't have proper access to the kind of high-speed internet that you need for that. So there was lots in the throne speech to be encouraged by. I've been a participant more as an advisor than a politician in preparing many of these addresses over the years by Her Majesty's representative, and I know now the hard part begins, which is actually the budget and the carrying through of the commitments. But I'm very heartened by quite a bit of what I heard today.
And just as a follow-up, I'm just wondering if you found that there was anything lacking, and I also just want to touch on the bars and restaurants that you spoke to at the beginning. As far as the hours of them, there has been the suggestion that in order to avoid a wider spread lockdown at a later point, that we could consider seeing some of the rollbacks, such as indoor dining or even bars being open indoors at all, just at least for a period until it cools off. Is that something that you and Dr. Davila are considering?
Well, Dr. Davila will speak for herself, but I will just say that from the standpoint of that kind of balanced resolution that addresses the health needs and tries to make sure that we're not, going back to a lockdown of those kinds of businesses that are struggling so hard right now to stay afloat, I think some alteration to how they do business, and especially the late night hours. I'm fond of repeating something my father used to say, which is nothing good happens after midnight. And so my original recommendations to the province a couple of months ago about bars, maybe went along those lines, and as people stay later and have more to drink and their inhibitions drop down in terms of mask wearing and contact with other people and so on, this is going to contribute to the spread of the virus. And the same with employees in some of those places where they might be having a well-deserved meal after work and so on. So there's just a whole lot of considerations there that are not intended to in any way harm the interests of those businesses, but rather to promote public health so that we can get more people healthier, faster, to go back to restaurants and bars and patronize them when times are better. And I will say that there's been some mention made in government discussions about programs to assist these businesses if it is necessary to impair their free and open ability to do business, to assist them in that regard beyond the assistance programs that are already there. And that's something I indicated that I'd like to explore if we get to the point, as I hope we do, where there are some alterations to the hours of business to make it a bit earlier for the closing.
Did you want anything, Dr. Davila?
Well, it's difficult to add to that. The mayor has become quite a public health expert in his own right, it seems. I think the only thing I can say is that, you know, in terms of COVID-19 control, we've spoken about that which individuals can do, right? Engage in the self-protection measures. From a government perspective, all three levels of government have a responsibility to help individuals in the case of COVID-19 by creating the conditions that actually facilitate the ability of those individuals to adopt those self-protective behaviors, which include that distancing and the mask wearing and the hand washing. So this is one such example, and these are all the policy alternatives that should be put on the table and considered very carefully, not only from the COVID-19 control point of view, but from the other aspects that the mayor just spoke of. What makes sense from a business and an economic perspective, what makes sense from a quality of life and a broader health perspective for the population beyond just COVID-19. So it's all those considerations that need to be looked at as we seek policy alternatives to help people in order to adopt those self-protective measures so that we can actually be successful against COVID-19 in our community.
Okay, thanks. We go next to Mark McAllister from City News. Mark, go ahead, please.
Thank you. Let me pick up on that point then. Obviously, the mayor has come forward and said there are 4 areas for action, fully supportive of taking those actions if you see fit, Dr. Davila. If we get there, you're speaking to having to look into things further. Which areas of those action are we going to see actual action on, and when?
So that's a great question. As it turns out, these are areas in which there is partnership and collaboration, as is the case with almost everything in respect of COVID-19. It's not something necessarily that the city can do or that I can do within my own authority alone. We're talking about significant policy alternatives for which we actually have to engage in discussion. That's actively happening right now. We have ourselves at the table. Other local public health units I know are engaging in active conversation, and as well the province, to try to determine what makes the most sense in terms of the circumstances that we see here versus what might be happening elsewhere. So, you know, I'm afraid you're going to have to stay tuned until then, but suffice it to say that with each of these considerations, we're thinking about what can we do at the different levels of government and in the different jurisdictions to help people be able to actually adopt and really implement on a more regular and consistent basis those self-protection measures that we know work. Watching your distance, wearing your mask, and washing your hands.
That's all. Thank you.
Okay, Mark, thank you. We go next to Richard Warnica from the National Post. Richard, go ahead, please.
Hi, Dr. Davila. Something I've heard from a number of experts this week and sort of normal people as well is that they don't feel that normal people have enough information about where people are actually contracting COVID. So there's the high-end data about community versus institutional, but they don't know if it's at a workplace, if it's eating at a restaurant, if it's in a playground, and that lack of knowledge is hurting the fight to change behavior right now. Could you give us some more information about where specifically you're seeing clusters of cases being acquired?
So what I can say is that, as it turns out, COVID-19 doesn't come from a place. It comes from one person to the next, right? That's how the virus spreads. Somebody who actually has a COVID-19 infection comes into close contact with another person, and through the respiratory droplets, the droplets that come out of the nose and mouth of that person who has the infection, you know, it goes, as they breathe and talk, these droplets are produced. Those droplets are emitted from the person's nose and mouth and then enter the eyes, nose, or mouth of another individual. That's how the virus is spread. So it can happen anywhere where that level of close contact happens. Fundamentally, COVID-19 is about the behaviors that people engage in, and that's why you'll hear me say time and time again, please limit your contact with people that you don't live with, right? If you have to actually engage in contacts in person with other people, think about what you can do to limit that in-person contact. How do you create distance? If you cannot create distance, then wear a mask, because that's what actually protects you and the other person from each other, the droplets that we inevitably put out when we speak or sing or cough or sneeze. So it's not about a place, it's actually about people and how they conduct themselves. If there are specific risks in any location, as is always the case in public health practice, we seek to inform those who are at risk. But fundamentally, when it comes to COVID-19, it is all about the behaviors. That's why you'll hear us talk about avoiding close contact, avoiding crowds, and avoiding crowds and close contact, especially when we talk about closed indoor spaces where the air just doesn't move as well.
Just to follow up then, I guess I'll be a little bit more specific. Have you seen cases where patrons at bars and restaurants have acquired from another person COVID at a bar or restaurant recently?
So when we look at cases, when we do that case management, what happens, as we've had some discussion before, is that we understand when the person might have had symptoms and try to understand what were the exposures, where might they have acquired that infection. And if we can find through that very thorough investigation, and it's quite a detailed interview and history taking, oftentimes we're looking back over a couple of weeks in their history and what their activities are. So very, very challenging to do for most people. We try to identify whether any of the places they were at might have had a case, and was there close contact with that particular case. So we have found particular cases in patrons where they do report, attendance at a bar or a restaurant and close contact with individual cases. But I'll remind you again that it's not about the bar or the restaurant. It's actually the fact that they had close contact with somebody who was, in fact, a case of COVID-19 or somebody who had a COVID-19 infection, because that's how the infection spreads. You need an individual with a COVID-19 infection with close contact with another person, such that the respiratory droplets, the stuff that comes out of their nose and mouth when they talk or cough or sneeze, goes from them, infected person, to another person close by, entering via their eyes, their nose, or their mouth. It's all about close contact, crowds, and especially closed spaces. These are the conditions that increase the risk of transmission.
Okay, thank you. We go next to Mike Walker from CTV News. Mike, go ahead.
Thank you for taking my question. Mayor and Dr. Davila, first I want to get your reaction to the news of the house party in Scarborough last night, where police fined 14 people for breaking the social gathering limits. And moving forward, what is the expectation in terms of enforcement for these rules? The deputy police chief today said there would be zero tolerance. What's the expectation for even the city's bylaw officers moving forward? Thank you.
So
I think it's actually better to have the police chief answer the question about what the police chief and his people and our Chief Davila, so I'll defer to them on this, except to say I've certainly made it very clear. I hope we're past the education time, we're past the warning time, we're on to the enforcement time, and I hope they will see fit to do whatever they think is appropriate in terms of enforcing the law as it exists, and it exists for a good public health reason.
Chief Raymer, can you add to that, please?
Yes, we now consider it a public safety issue. We're working very closely with the city to attend complaints, and where we can and where appropriate, charges will be laid.
Follow up, Mike?
Yeah, and I just want to get your initial reaction to when you, Mayor Tory and Dr. Davila, when you heard about this large gathering that happened last night that police responded to.
You know, we've been having these press conferences for 6 months, and throughout that time, whether the limits were, 10 or 15 or 20 or higher, we've been talking about how that these kinds of crowd scenes and parties are places where this virus spreads. And I just would think, as a matter of self-preservation and respect for your relatives that you might live with, or respect with your people you work with, or your friends, or your own family, people wouldn't go to those parties anymore or hold them. but they do, and the police attended, and they wrote a number of pretty substantial tickets to people, and I hope that sends a powerful message about that sort of thing being, inconsiderate, in a way incomprehensible behavior after all this time and all that we've been through and all the sacrifices people have made. And what more can you say?
Well, I think the only more that we can say is that we need to commit to engaging in the appropriate behaviors, right? The behaviors that will protect ourselves and protect our community and get us to a point where we are able to enjoy our city, get our city back, and get beyond COVID-19. So I would just put that out to the residents of Toronto. The more we are able to abide by the self-protection measures, you protect yourself, you protect others around you, and you preserve quality of life in our city.
Okay, final question is to Dave Ryder from the Toronto Star. Go ahead, Dave. Dave, you there? We've been having some technical issues with your connection today, Dave. I'm sorry. We'll, if you want to send me an email, we'll try and get an answer for you. No, not there. Okay. Thank you, everybody. That concludes today's briefing. Have a good evening.